Recently just had my left hip replaced, and back in 2017 I had my right hip replaced. With the pain that I was in pre-op, it could have been quite easy to have stayed on the sofa. So I'm doing a little bit of training at the minute, because on April the 6th, travelling out to France to take on Paris-Roubaix. We're riding in the Sportif the day before the professionals ride, covering 170 kilometres over some horrendous roads. You can see the grimace on that bloke's face. It's always been a big passion to be involved in every type of sport, from early days of playing badminton through to martial arts to now on the bike. So every sport I play, try or get involved in, I give it my all. Pre-op, it was over a period of time I get shooting pains down my left leg and right leg. Now I am absolutely pain-free. Mobility straight after the operation was so quick. It felt like I had so much more movement the day after. It's only now that we're talking about it that you remember how uncomfortable it was.
If we were sort of looking to go away somewhere, we had to think about where we were going to stay because of how far we had to walk, you know, for dinner, for coffee, for going out in the evening.
That's when I went to see Mr. Kulkarni, and that's when we found out that it needed to be done.
Hip replacement is where you change the degenerated ball and socket to an artificial one. Hip replacement changes people's quality of life hugely.
So this is Charlotte, my daughter, who's getting married to Joe in July.
Bit close.
So one of the main reasons getting my hip done was so I was not hobbling down the aisle. The two options were the traditional hip replacement or a SuperPath. SuperPath would give quicker recovery. I had a week off work. I think with the traditional ones you could be on crutches for quite some time. I think there's probably a couple of months at least.
So SuperPath hip replacement is a minimally invasive approach to the hip replacement surgery. You do less damage to the tissues by cutting less and spreading more. It means you're keeping the envelope of the tissue pretty much intact around the hip, and that's why you have less pain, quicker mobility, better stability, and early return to function.
My body certainly feels like it's new again. I feel quite youthful again, back to normality. It feels like I have a lease of life again. So it's not something I think about having two new hips. I just feel as if I'm normal.